Action.
Wait, are they in their bag?
That's fine. Okay.
Hi, I'm Michaela Boldick.
I'm Alex.
I'm Janine.
And I'm Sarah.
And our project is polymer coating for vascular valve stents. Heart valve disease is diagnosed in 5 million Americans every year. Heart valve disease can be affected at any gender and any age, leading to heart failure, stroke, blood clots, or death due to sudden cardiac arrest. The current method of a more permanent treatment for heart valve disease is a valve replacement. According to Edwards Life Science, more than 25,000 heart valve replacements occur each year. Based on the diagnosis increase in the past few years, the number of patients requiring heart valve replacements will triple by 2050. There are 3 different types of options for heart valve replacements: tissue valves, mechanical valves, and heart valve tissue stents. Heart valve replacement stents requires a less invasive surgery being inserted through a catheter, causing a quicker recovery time to patients. The stent is expandable, fitting a patient better and reducing the risk of blood clots. There are some limitations to this method. The non-degradable polymer coatings, such as PET used in the current stents, can be cytotoxic. The stents can cause fibrotic encapsulation, and using tissue leaflets will actually call for a valve replacement in 5 to 15 years.
So because of this, there is a need for a heart valve stent that is able to better integrate with the surrounding tissue in order to incorporate both the positive and positive of tissue stents while reducing the limitations. So our bicuspid valve would use an existing collapsible cobalt chrome cage design for the stent in order for it to be implantable via catheter. The bicuspid valve would be created with an existing flap design that can promote the major improvement of this bicuspid stent valve is the dual layer polymer coating. The inner layer is able to coat the cage, which would be a PLLA spray that would degrade in about 5 years. This would prevent the cobalt chrome cage from releasing particles that could be toxic to the surrounding tissue. The outermost layer would be a full coating of polyanhydride loaded with growth factor to promote regeneration, which would, so the polyanhydride that we're using is a methacrylated polyanhydride, which would extend the degradation time beyond pure polyanhydride to about 2 weeks, but it would still be a soft polymer. So cross-linking the polymer would provide additional structure and allow it to still be suitable for tissue applications. The growth factor that we'll be using to chemically incorporate to the surface of the polyanhydride is VEGF, which has been studied for use on heart valves to improve hemocompatibility, reduce platelet adhesion, while also promoting cell migration and adhesion to the surface.
There are several benefits of a heart valve cage stent with a polymer coating. In terms of biocompatibility, the stent will have a high wear resistance, therefore it will minimize debris, which may cause inflammation or pain to the patient. In terms of biofunctionality, the stent will promote tissue integration, which makes it less vulnerable to bacterial infection. The stent will also have a degradation rate to match the heart valve regeneration time. The polymer coating around the stent will promote integration, and it will not fully degrade until the tissue has been fully integrated. The stent may be more expensive, but it could be cheaper than using a stent with donor tissue included. In terms of biomechanical benefits, the stent will be flexible, expandable, and have a low modulus, which is desirable for a heart valve tissue. The risk of the stent is greatly reduced because it does not require open heart surgery for implantation, but it could be inserted through the ribcage via catheter. An average heart valve can cost between $5,000 to $7,000.
These are 2 examples of heart valves currently on the market. The first one is the Edwards transcatheter heart valve, which has a cobalt chrome frame like ours, but it has a non-degradable polymer skirt of PET, which have a cytotoxic reaction over time. And it also has an inner bovine pericardial tissue, which makes it expensive. It's about $25,000. And there are no long-term clinical data available about its success rates. The next one is the Medtronic valve, and it also has an inner animal tissue, and It has a nitinol frame, which is a nickel titanium alloy, and it also would be similarly expensive to the Edwards one because of the animal tissue, and it would require a replacement between 5 and 15 years because of degradation of the leaflets.
Thank you.
Thank you.